Hey guys, what's up? Stevie G here. So I'm coming to you now with a new series of dope videos that we've curated called Sculpted Studies, right? A bunch of little topics that we get into, tips, tricks, advice, stuff that we go into detail in all of our training classes, but I'd like to deliver this information to you guys over the Instagram platform. That way you can start using these tips and tricks into your daily practice. So, a question I get a lot, especially with a lot of machines and all the different techniques, is what is a stroke? How does it affect me? And what's the difference between that and a needle hang? So we'll get into that today. So first thing is stroke. What is stroke, right? Every different machine has a different size stroke. Anywhere from 1.8 millimeters all the way up to 3.7, in some cases 4.0. The measurement of the stroke is, well, if you really get into it, is the distance of the off-center cam on the inside of the machine that spins and pushes the needle forward, right? A little bit confusing, but what does that mean exactly to us in our practice? So the stroke is the distance of how far the needle moves from its resting position to its finishing position, right? So when you run the machine, regardless of how far you have the needle out, as you're running it, when it's from this point where it stopped to that point, that is the stroke distance. On the Apollo, that distance is 2.3 millimeters. So that is a 2.3 millimeter stroke. The bigger the stroke, the little bit more bigger of an impact, right? So smaller stroke machines tend to be a little softer on the skin. If the motor was exactly the same, the motor that's pushing the smaller stroke would have a little bit less impact than if it has a larger impact. You can think of it kind of as like a golf swing, a bigger wind-up, right? Or a punch, right? The further back you go, a little bit more inertia it has to impact the skin. We've kind of dialed down the point that permanent makeup machines tend to do their best work between 1.8 and 2.5, 2.7 millimeters. Some people prefer them a little longer, but it's important to know, how these things affect the way you're working. One of the main things that it does affect is your needle hang. Some call it the needle float, floating your needle, hanging your needle. In this case, we're gonna call it the needle hang. So the needle hang is how far your needle is coming out of the cartridge, right? So by adjusting your needle while it's running, this would be you hanging the needle all the way out compared to if you pull it back when the needle's closest to the cartridge, that we call riding the cartridge. So you'd be riding the needle when it's all the way out, riding the tip, and then all the way back here, you are riding the cartridge. So what's the difference? It's really just preference, right? No matter how far you have the needle out, you're still trying to go to the same sweet spot of the skin. In this case, the papillary layer of the dermis. That distance is always changing and everybody's skin is always different. So you don't set your machine to a specific depth. You'll never get there. I guess you can say if the needle hang is all the way out, sure, you can go a little bit deeper if you're not minding your pressure. Shouldn't be doing that, but I guess technically it can happen. But for the most part, people who hang their needle all the way out, I'm one of them, is so that you can get better vision. I can see the tip of the needle actually insert into the skin exactly where it needs to go. I can see it, I can feel it, and having that long needle hang allows me to get the proper depth. Some people prefer it a little bit closer to the cartridge because they know that if the plastic touches or gets nearer to the skin, then they're going too deep. I don't really agree with that method, but again, it's preference. Also, some things to consider is that if you are riding a cartridge, if the plastic does touch the skin, not only will you kind of make a mess, but that plastic around the needle will also depress the skin, making the needle go deeper. So it's still, you need to worry about your pressure. None of these things are going to change that, but adjusting that length, depending on what different procedure you're doing, may aid in your overall effectiveness. Something to consider when you're kind of deciding whether you're hanging your needle all the way out or bringing it close to the cartridge is better for you. A big issue with that, other than sight, is your ink flow, right? So the way ink flows out of a needle cartridge is, this whole piece of plastic gets filled with pigment. Every time the needle comes back into the housing, it can grab some ink and then push it out and continue to work. In some cases, depending on the needle size, grouping, depending on the housing, you'll find different parameters for your ink flow. For the most part, if your needle hang is all the way out, and when you stop the machine and it's not going back into the cartridge, you may experience some ink flow issues. So you may want to pull it back a little bit. That way, when the needle's coming back into the housing, it can grab ink and you can get some really nice flow. Also, if you've got it, again, if it's really close to the housing, sometimes the ink can drip a little bit and the tip of the needle can touch various parts of the skin and you can make a little bit of a mess. So like I said, depending on the type of pigment that you're using, how the viscosity of the pigment is, all of these other parameters affect how you're going to hang your needle out. So adjust it and see what works best for you. When I'm working on a scalp, I'm adjusting it a couple times as I move, from the front of the head and back and choosing different places. Whether you're working on a lip or an eyebrow, sometimes you're changing pigments, you're definitely changing needles. So adjust the needle throw and see which hang works for you, right? And also remember that the stroke is not equal to your needle hang, but your stroke is going to increase or decrease the distance that the needle is moving from front to back. So if you are one of those people who really like a really long needle hang and you feel like you're not getting enough pigment but you need that distance, maybe a longer stroke machine is better for you. That's what's really cool about the Zion line, is that you can interchange all of those strokes, anywhere from a 1.8 to a 3.7, which is really cool. And then other machines that have fixed stroke, like the Apollo and the Bilar and other brands that do that, just keep in mind that that's one of those factors that's going to help you decide which machine you may or may not use for specific procedures. So I hope you guys enjoyed that little information. We'll see you soon with the next topic. So this was Sculpted Studies. See you next time.